Welcome to Community Connections, brought to you by SCAN, the Social Community Activities Network, New Jersey's premier provider of continuing education for adults since 1988.
Hello, my name is Tom Hayes. I'm Director of Customer and Community Relations for New Jersey Natural Gas and your host for Community Connections here at SCAN, which is a wonderful program where we have opportunity to let you know about wonderful things going on in our community. Today we're very fortunate to have our first guest for today, and that's Barbara Richardson, and she's the Regional Radiology Director for Monmouth Medical Center and Monmouth Medical Center Southern Campus. So Barbara, it's really nice to have you with us. We're glad you could take the time out of your day to come and talk to us about your programs. So first of all, tell us a little bit about osteoporosis.
Okay, well, osteoporosis is a condition where it affects the bones, and it actually makes the bones more fragile. And what actually osteoporosis actually means, porous bones. And you're at a much higher risk for fractures. And we want our patient, want everyone to know this is a condition that we can identify, but the only way to identify it is with the DEXA scan. So osteoporosis is really that condition of the bones becoming much weaker.
Okay. Wow. Now, why is osteoporosis known as the silent killer?
The only time you really know that you have osteoporosis is if you have an actual exam called a DEXA scan that really measures the bone density or the bone mass. Or what unfortunately happens is most patients find out after they've fractured a bone, and that's when they are diagnosed with osteoporosis. So we want to identify it sooner so they can start to take steps to prevent it.
Okay. And if they don't prevent it, what happens?
Fractures.
Just the fractures keep
Yes.
up, but okay.
Half of the women over 50 years old will develop a fracture in their lifetime because of osteoporosis.
Okay, gotcha. And I guess if they get that fracture, the silent killer part is that it really inhibits their mobility and starts a downward
it's that much
trend.
harder for you to heal, especially with
Right.
somebody who has a broken hip or a broken spine. If you're elderly and you're laying in that bed long, it's a hard disease to recover from. So we want to make sure patients are taking care of their health and making sure they take care of bone health as well.
Gotcha. And now you mentioned the DEXA scan?
Yes,
okay.
and our DEXA scan is a very simple study. It's a scan that we use X-ray technology with, and it actually measures the bone density or the bone mass that the patient has. So when we look at that, the doctors can then come up with a T-score, and based on that score, they can determine if the patient has osteoporosis or has osteopenia. Based on that diagnosis, then the patient can be told with their doctor what the next steps are to help them to have better bone health.
Now, what's the difference between osteoporosis and osteopenia?
It's actually the amount of minerals and calcium that have been lost from the bone density. So if it's really more severe, it's called osteoporosis. When we start to see it starting to be less, call it osteopenia.
Oh, wonderful. Good to know.
Yes.
See, I get to learn so many things on this program myself, which is great. So who needs a DEXA scan?
Well, anybody that's over the age of, any women over the age of 65 and any man over the age of 70 should have a baseline. But there's also the National Osteoporosis Foundation also recommends with anybody with any kind of risk factors that they actually start between 50 and 65. So you really want them to have it based on risk factors, age, to have that DEXA scan. And you want the baseline so you have an idea of where your bone health is. And then as you get older, you can watch to see it that it isn't going down too far.
Okay, very good. So it's again one of those things you want to be as preventative as possible, and the way you're going to start to really know about it is getting the scan, so you really keep track of where you are at any given time, right? That's good. It's always that first step that's really important, to make sure you're finding out where you are at that moment in time, and you can get the help you need as soon as you need it, right?
Yes.
And I'm sure that's another one of those areas where folks tend to wait too long or
unfortunately, we don't see enough patients having the bone density studies. We actually see many more patients because it's the only way to identify what your bone density is or your bone strength. And if once we know that we have it, then your doctors can then make a recommendation to see what is the next steps.
Okay. And you mentioned a little bit the risk factors requiring early testing. What were those again?
Well, there's some risk factors. A lot of it is, it's a very broad considerations: age, body weight, if you have a family history of osteoporosis with or without fractures, if you are a smoker, if you drink more than 3 alcoholic drinks a day, if you had prolonged steroid medication use. There's also some medical conditions that also affect your bone, like rheumatoid arthritis or celiac disease, and there's also some medications that patients take that actually are bone thinning. So you really have to speak to your doctor to find out, are you at risk?
Wow, that's pretty amazing. So there's some medicines that are actually bone thinning.
Yes.
Do most doctors warn their patients about that or let them know about that, or is that a hard?
Not always, and I don't
Okay.
usually, when you're taking it, it's not the first priority, but
Right.
it does have an effect over long-term use.
Gotcha.
So when you get to that certain age, and now our seniors are much more active, so at so much more greater risk, because not because they're older, because they're active and they're out there doing things that they may become injured. So we
Right,
want to make
right.
sure that,
Right, that's okay. Go ahead.
okay, that we want to make sure that they really are having
Right, right. The tests and,
the test
and all that
themselves.
sort of thing.
Yes.
So are most patients getting the DEXA test that they need on a regular
No, we
basis?
still need to encourage people to get out there and have those exams. And all they really have to do is talk to their physician and have that recommendation done.
Right, gotcha. Okay, good to know. Now, does it matter where you have the test and who does the testing?
Well, you want to have the study done in the same machine once you select a machine to have it on, because you are doing comparisons, and even just that little bit of difference will make a difference. So we like to have, we offer them at all the Barnabas Health sites, at Monmouth Medical Center in Long Branch and at Monmouth Medical Center Southern Campus at Lakewood. We do quality assurance testing every day. We have a health physicist that oversees that testing. And we also have a radiologic technologist that's certified and licensed
Right, okay, gotcha.
that's performing those studies.
Good. So you've got the experts who really
do.
know what they're doing.
So,
Great.
and it's convenient, appointments are very easy to be, and it's a very short procedure.
Right, right. Okay, good. Now, how about in terms of insurance? Do the insurers pay those fees?
We see most of our insurance will cover everybody. Based on your policy, you always have to check. Every payer is a little bit different, but we do see most insurance cover DEXA scans. Medicare covers it every 2 years. Based on the recommendation, it is common for patients after their baseline to have it every 2 years.
Okay, so as you said that, it rang in my head that every 2 years is when you should have it once you've been...
Right, and then they're
okay.
watching it, because you may be fine today, but in 2 years or 4 years, you may have an issue that needs to be
Okay.
addressed.
So just to go over that again, if you get a DEXA scan and everything's fine, when is the next scan recommended to get? Is it 2 years or is it longer?
It's really based on the findings from the preliminary
Okay.
one and your risk factors.
Gotcha. Okay, so
So your physician would make that recommendation.
okay, so but theoretically it could be 3 or 4 years if everything was perfect and
It could
didn't
be.
have any indicators.
But again, there's not going
Yeah.
to be any symptoms to tell you that there's a
Right,
problem. So
right.
usually it tends to be 2 years, but
Okay.
it can be varied.
Okay, gotcha. And the locations where they could get them taken at your facilities are again?
At the radiology department in Monmouth Medical Center and at Monmouth Medical Center Southern Campus.
Okay, so
So
that's
all they
in
have to do is
Long
call
Branch
and-
or Lakewood,
Yes.
right? Yeah, that's great. That's great, and which are beautiful facilities, by the way.
And then we have the latest technology. We actually just upgraded both machines. New machines have been put in, and so we really are offering the latest technology available.
Excellent. And that's important. Everybody wants the latest technology.
You do.
So, and I know it's a big investment, which is all
Yeah,
part of
all of
how
radiology
healthcare
is
and all
very
that.
expensive.
Yeah, yeah, but it's important
It is,
to get that.
and we want to always maintain that level
Yeah.
of quality to get our patients the best diagnostic tools that we can for them.
Right, right, for sure. So, what can you do if you're diagnosed with osteoporosis?
Well, there's ways to prevent it and there's ways to treat it. The first thing is we want to make sure you're having a good diet. We want to look at your calcium intake, your vitamin D, and exercise.
Okay,
If
so
it
it's
is-
calcium, vitamin D, and the exercise.
Yes,
Okay.
weight-bearing exercises is preferred
Oh,
for
okay.
osteoporosis.
Okay.
And then once you are diagnosed, there are medications. There's actually 9 medications that are FDA approved that can be used, but that's something that's going to be decided between the physician and the patient based on, whatever the patient's situation is at that time. That's going to be individualized.
Right.
And then it goes back to good exercise, good diet, making sure we're getting those vitamins, and making sure we know what our bone health is, getting those testing done.
Right. But that's interesting. You said weight-bearing exercise. So, my intuitively, I might have thought the opposite, like not putting too much stress on the bones. But
Right.
it sounds like you want folks to put
We
that.
do.
Oh, okay, so that actually helps the bone
To be stronger.
strengthen. Ah.
Yes.
So that's always good for people to think about that as well, right? So when they're doing their exercise, walking, and that sort of thing, they should also be doing things that are, is that considered weight-bearing enough to be walking as opposed
Yeah,
to other?
to start,
okay.
that's wonderful.
Okay.
We
Great.
just need people out there doing what we know they need to do.
Right, right.
Get out there and move.
Right. And I think we've always heard about calcium, how important that is, especially as you age, right? And when we were kids, we always got your calcium through milk and things like that. But now there's a lot of vitamins and things like that. Is that appropriate? Are they all good, or are there some that quality levels different?
There are different levels, and it's something that you do want to speak to your physician about based on your particular situation, because you don't want to overdo it either.
Right.
Vitamins are something that you can overdo.
Yeah.
Sometimes people take too many supplements.
Yeah, right.
So you want to make sure that they are monitored.
Yeah, because I hear some folks have had issues like that where their bodies can't even absorb all of the vitamins they're taking, and it's almost a waste.
Yes, and the same thing, if you're not getting enough intake, that's why your bones become weak. It actually your bones start to give it to your body. The minerals and the calcium come out of your bones, and that's why you're getting the weaker bones.
Wow.
So
that's interesting to know too.
I mean, your bones are important for a lot of things. That you have to stand up strong and to be able to protect all your organs, as well as for your red blood cells and for the immune system. So it really has a lot to do with your overall health.
Right. That's fascinating. Now, if folks wanted to contact you, what is your contact information?
Okay, I'm at Monmouth Medical Center, and the main number there is 732-923-6800.
Great. Okay. And again, you have facilities in Long Branch
both
and
places.
Lakewood.
Yes.
And it's Monmouth Medical Center in Lakewood and Monmouth Medical Center Southern Campus in Lakewood.
Yes.
That's great. And again, your team has always been wonderful in the community. And I know Monmouth Medical, the whole system, is very supportive of SCAN, which we very much appreciate here at SCAN.
Thank
because
you.
we try to provide wonderful programs for all of our members, and we can't do that without support.
Well, we're here for the same reason, to keep people healthy and to keep people well. I mean, we always prepare our patients to be healthy and only visit us for screening studies.
Right.
And when we're there for when they need us.
Right, which is important. And again, the whole radiology field is a developing one all the time. As you said, new technology, new equipment. Again, you're getting the latest of technology.
The earlier detection, the earlier the treatment can begin, and we're seeing so much more. We can see things that we never saw before, and it's quick. Studies are so much quicker than they used to be. You can have CAT scans in 10 minutes, and like this DEXA scan is a 10-minute on the table. They look at your hip or your spine, and it's over. There's nothing it's not painful. There's no side effects. It's minimal radiation. It's a study that you really need to just not even be fearful of. Just come in, have it done, and know what your bone health is.
That's great. And tell me what, I know one of the things I was reading about or saw, the FRAX. What is the FRAX?
It actually is it's a ratio that actually they figure out to find out what is your risk of a fracture over the next 10 years.
Okay.
And that way your doctor can then determine, do you need prescription medication based on that risk factor.
Right, okay.
So we use it in conjunction with the DEXA scan.
Right, okay. Oh, that's very interesting. It's amazing all the different elements that are involved with all these procedures.
It is amazing that we can tell that just from a picture, that we can now tell you how strong your bones are, or if you need something else.
Right. No, that's excellent. And now, may I ask, how long have you been with the organization?
Over 30 years.
Oh, no kidding. What, were you 3 when you started?
Yes.
Wow, it's pretty amazing.
Yes.
That's very, and I think you were telling me you started up in the Livingston area, right?
Yes.
And now have been...
Yes, Barnabas Health is growing, and it's a wonderful organization, and we really are all here to serve our communities.
Yeah, it's really important. That's great. And again, you guys do wonders down here in our area, and certainly we appreciate all what you do in our community. So I have... basically just really want to thank you for all that you've been doing for the community, and certainly your programs, and I really thank you for being our guest today. And it's wonderful to have had you here, and really to let all our viewers know about the wonderful programs that you offer.
All right, well, thank you.
Thank you. And thank you, and stay tuned. We're going to be having a commercial break, and we'll be back after that.
Now's a great time to make your home more energy efficient, and the New Jersey Natural Gas Save Green Project is here to help. Take advantage of rebates and incentives up to $19,000 designed to make your whole house more comfortable, improve performance, and save you money. Upgrade your older, inefficient heating equipment, central air conditioning system, and water heater with money-saving, high-efficiency equipment. But don't stop there. Your new equipment will have to work harder, wasting energy dollars if your home is not properly weatherized by reducing air and duct leaks and installing proper insulation. Call the Save Green Project at 877-455-NJNG or visit SaveGreenProject.com, and we'll help you get on the road to energy efficiency and savings, and explain how you may qualify for up to $19,000 in rebates and incentives. Call Save Green at 877-455-NJNG.
Hello and welcome back to our Community Connections program here at SCAN. It's great to have you with us today. For second part of our program, we have two wonderful guests that are going to be with us. We have Dr. Manpreet Kohli and Dr. Sumi Chang, who are board certified breast surgeons at the Jacqueline M. Mullentz Comprehensive Breast Center and Monmouth Medical Center. That is a mouthful.
Sorry.
You have to go around and say that all the time? That full thing? Yeah.
Yeah,
Wow.
it's the first way we impress people.
Yeah.
Just by saying it correctly.
That is impressive. The other thing I'm sure is impressive is that you're both fellowship trained breast surgeons, right?
Yes.
So can you tell us a little bit about what that means?
So as surgeons, we actually go through, in addition to medical school, we have 5 years of general surgery training, where we are working with attending surgeons and learning the skills of the trade. And that is what is the general surgery training is about. In addition to that, what Dr. Kohli and I have gone through is a dedicated breast surgery fellowship where we focus on taking care of breast cancer patients and learning about the treatment from different perspectives, from the surgeon's perspective, as well as medical oncologist, radiation oncologist, pathologist, radiologist, so that we actually have a broad overview of that specialty and the research, the techniques and innovation that are occurring in that specialty.
Right. Well, that's pretty amazing.
Right.
I'm sure there's a lot of time and studies and all that involved in all that, right?
Right. I mean, there are general surgeons who treat breast cancer and breast diseases also, but we have a little bit more experience being subspecialty trained, focused just towards breast health and breast cancer. So that really makes it so that we can focus our practice 100% towards just breast diseases, whereas sometimes you have general surgeons who may be doing surgery for a gallbladder one day, lipoma or hernia the next day, and then breast disease. Our practice is entirely related to the breast.
Very exclusive and
Exactly.
focused, and that's great.
In addition, we did our training with busy breast surgeons in New York, so we have a wide array of exposure. We both trained, incidentally, at Beth Israel St. Luke Roosevelt Hospital, which is now part of Mount Sinai Health System.
Gotcha.
So we've had a huge amount of exposure working with almost 10 busy breast surgeons, dedicated breast surgeons like us.
Wow,
Right.
amazing.
So we can bring the New York experience back home, so women don't have to run away to New York to get their care.
Right, right. And speaking of breast cancer and all that, and certainly we know how important the mammogram is, right? So tell us why women should be getting their mammogram tests.
Well, most of us know somebody who's had breast cancer, just by virtue of it being so common. 1 in 8 women today in the United States will develop breast cancer at some point in their lifetime. And in 75% of the cases, these women who develop breast cancer have no identifiable risk factor and no family history.
Wow.
So that's why screening is important. Screening really refers to looking for a disease in someone who has no symptoms and no reason why they should develop breast cancer. So today, screening really consists of mammograms every year on an annual basis. And when we do that, it's a pretty straightforward procedure. They've made a lot of advances in the imaging so that the radiation is limited. Women, get less radiation than a normal X-ray of the chest, and they have really good sensitive ways of identifying breast cancers at really early stages. In the past, breast cancers used to come up as something women could feel in the breast. Now, because imaging quality is so good, we're able to find cancers when they're so small you would never feel them, which then translates into us finding them at an earlier stage when they're more treatable, and then women may not need to get certain treatments down the road, like chemotherapy and radiation. So that's really why it's very important, because we're all at risk. It's not just reserved for women who have maybe had a sister or a mother with breast cancer. All women are at risk of developing breast cancer, so we need to be careful to look for it.
Right. That is remarkable that you can find it so early, though, too, which is great, which is progress, which is, why hospitals like yours, have to be up with the times and getting the right equipment to make sure that they really can detect these things earlier than ever, right?
Yes.
Exactly.
Technology has improved a lot, where digital mammography has much clearer pictures of the breast compared to the analog pictures. And also we, at Monmouth Medical Center, we have dedicated breast imagers whose full job is looking at mammograms, breast ultrasound. So they are very experienced in interpreting and deciphering whether a patient needs additional imaging or they are all in the clear.
That's pretty amazing. So they're like you said, dedicated to that. So they
Yes.
are experts and thorough, and they can probably pick up on any little item that they know needs to be
Right.
looked at further, and made sure that the women that are going for these services and getting these mammograms are really getting the best treatment right away.
Exactly. You know,
That's
they're not
amazing.
looking at MRI of the back for something else one day. They're just how our practice is 100% focused towards breast disease, so is theirs as radiologists. So they really are able to find very subtle changes from year to year. So it's impressive.
That is impressive. I feel better already.
Good.
No, that's really great. I think that's wonderful. Now, you were mentioning some of the risk factors, or there's some folks might be predisposed. So, what are some of the risk factors that might predispose somebody to, breast cancer?
Sure.
So one of the main risk factor is being a woman and having breasts is a risk factor, and that's why we recommend screening for screening mammograms. Additional risk factors that we also check is family history, whether it is a mom, a sister, cousin, and both family history. When we talk about family history, we want to know from both mom's side as well as dad's side, not just the mother's side, which could mislead a lot of patients into thinking they don't have anything because they don't look at their father's family history.
Gotcha.
In addition, we also look at whether a woman's had exposure to radiation as a child for treatment of other diseases such as lymphoma, where we may have had radiation. They may have had radiation to the chest wall area and the neck area, where they may have had exposure to the breast, which puts increased risk. In addition, they are also, if they've had biopsy themselves of the breast, where they might be benign, which is not cancer, but little findings that may indicate to us that they may be at risk for future cancer. So those are some of the risk factors that we look at.
Gotcha. It's pretty amazing. There's a lot of little nuances that you really have to be aware of and
Right.
really be
Yes.
checking into.
And one
Right.
of the main risk factors, we also tell patients certain ethnic background, such as if being Ashkenazi Jewish descent, also does increase the risk factor, simply because of increased risk of breast cancer within that community.
Interesting also.
Right.
Yeah, it's pretty...
It's very multifactorial. So it would be great if there was just one reason why women
Right,
get breast
right,
cancer,
right.
then we could possibly cure it. But because there are so many different risk factors, it's important to know all of them so, it becomes a complete picture,
Right.
you.
And when you say that, so there's many factors and different reasons why somebody might develop breast cancer. But tell me the other part of it, like how has the treatment changed over the years?
The treatment for breast cancer has advanced significantly just by virtue of it being such a common problem with women today. It's become a focus of a lot of attention and research over the years. So it's one of the cancers that has received a lot of funding and a lot of advancements as a result. So if you compare today how women are treated for breast cancer to how it was 20 years ago, it's dramatically different. In the past, women were kind of treated with a cookie cutter algorithm, where they would come in and have breast cancer, and they would say, okay, you need a mastectomy, we're removing the whole breast, all the lymph nodes, the muscle, then you're going to get chemotherapy, you're going to get radiation, and it was very toxic, very disfiguring, and it would lead to a lot of complications. Sometimes women would have long-term swelling of the arm, which is known as lymphedema, as a result of removing all of the lymph nodes. And it was, when you think back of maybe family members who were treated for breast cancer decades ago, it puts a lot of fear in women's minds.
Sure.
Today, it's very different. Today, because, as we mentioned before, cancers are found at an earlier stage when they're smaller, most women can preserve their breasts Most women don't even need mastectomies and can actually get breast conservation therapy, which is when a lumpectomy is performed and the woman keeps the rest of her breast tissue. The tumor and a rim of normal tissue is removed. We can also selectively remove lymph nodes so that not all the lymph nodes need to be removed. We can stage them appropriately, but really reduce the chances of having arm swelling later on. And again, not all women need chemotherapy today.
Right.
Sometimes they can benefit from an oral medication that's taken daily, and that can reduce the chances of the breast cancer coming back. And even radiation treatments today, if they're required, are very, very well tolerated. Most women work throughout radiation and don't feel many ill effects. So it's really dramatically changed. And most women, because we know now it's much more treatable than it was in the past, the survival rates have really improved. So for early stage breast cancer, there's a 98% survival. And that's very dramatic. So we can think about how the woman will feel 10 years from now and not really have to say it's a life or death decision today. We can think about cosmesis and them feeling like themselves, because in the timeline of their life, in the vast majority of cases, they'll get past this hard patch and live beyond breast cancer.
Right.
And we want to remember that they can still maintain their femininity. They can keep their breasts.
Right.
Even if a mastectomy is required, sometimes women actually are happier with the pair they get afterwards because they can pick their pair, they can get reconstruction and have a great result.
Right.
The options are really limitless and now very individualized for the patient, because each woman is different and each breast cancer is different. So one woman's treatment may not be the same as the next because it's very focused and it's very tailor-made just for that woman.
That's great.
And with radiation, women worry about radiation because of its unknown entity. Nowadays, we have improved technology with radiation where the radiation machine monitors the patient's breathing and treat accordingly in how they're following their breathing pattern, which is what we do now at Monmouth Medical Center to avoid radiation side effects to any of the other areas, even the surrounding areas of the breast.
I see. Now,
So-
when you say that, you mean like when you're breathing, your body's moving a little bit, so it's trying to make sure it stays within the region it's trying to focus on and doesn't expand beyond that just because somebody's
Yes.
breathing and moved a little bit, it might be off kilter a little bit.
We don't want
Yes.
to treat the lung or the ribs if we can
Yeah.
avoid it.
That's
Exactly.
amazing.
When we breathe in, we actually treat, and when you breathe out, it doesn't. So the machine, the technology has advanced significantly.
remarkable.
It's not the same side effects that they may have thought of or they may have seen from their mothers or their grandmothers.
Right, that's pretty impressive. Now we just have a few seconds left, so just tell us the contact information if folks want to get a hold of you.
Sure, we both work with Barnabas Health Medical Group, really at Monmouth Medical Center, Community Medical Center, and even Monmouth Medical Center Southern Campus. And our phone number to reach the fellowship-trained breast surgeons of Barnabas Health Medical Group is 732-923-7702.
Great. Well, I want to thank you both for being here. You've been wonderful. I still think it's amazing. You seem so young and all that's great. So
Thank you.
Keep up the good work.
We're
Thank
happy
you
to
for
be
having
here.
us.
Thank you so
Very
much.
good. And thank you for watching. We appreciate it as well.